Modern childbirth mechanization may be shocking, but it is not necessarily happening everywhere. The progressive modern nations that have the best birth outcomes achieve them because of the practices they follow. At the bottom of the list has often been America. In a joint investigation, the NPR reported in 2017 that more American women are dying of pregnancy-related complications than any other developed country. Only in the United States has the rate of women who die been rising. Maternal mortality is commonly worst in economically poor countries in Africa, followed by Central and South American countries, as well as Asia. Other countries which fared worse than the United States included South Africa, Brazil, Mexico, Egypt, China, Russia, and Iran. Reasons cited for the higher rates of maternal mortality in developed nations include greater prevalence of C-sections leading to more life-threatening complications, the fragmented health insurance system, and caregiver confusion or error. Among the lowest in maternal mortality are countries like Greece, Iceland, Poland, Finland, Czechia, Kuwait, Italy, Sweden, Belarus, and Austria. In 2018, CNN reported that the United States also has the worst overall child mortality rate amongst 20 wealthy nations. Other countries also considered to be above the overall average include Switzerland, New Zealand, the Netherlands, Ireland, the United Kingdom, Canada, and Australia. The primary cause of infant mortality in developed nations is preterm labor, when babies are born too early. Causes of preterm labor include psychological stress, premature rupture of membranes, bleeding during pregnancy, high blood pressure disorders and weak cervix, as well as smoking cigarettes, drinking, and diabetes. In turn, one's maintenance of her 5 foundations stands to address several of these factors directly. Infant mortality is lowest in countries like Finland, Japan, Portugal, Sweden, Czech Republic, Norway, Korea, Spain, Denmark, and Germany. Among the lowest in maternal mortality are countries like Greece, Iceland, Poland, Finland, Czechia, Kuwait, Italy, Sweden, Belarus, and Australia. There is also a disparity in government-supported time off for new parents. The 2 countries in the world that provide no type of financial support for mothers are Papua New Guinea and the United States. The countries that offer the longest and paid leave are Bulgaria, Greece, United Kingdom, Slovakia, Croatia, Czech Republic, Ireland, Hungary, Italy, Estonia, and Poland. In countries with longer periods of parental leave, children were found to be breastfed for longer and their life expectancy was higher. Why is there such a disparity between nations when it comes to childbirth? A nation's childbirth statistics are often a cumulative reflection of the policies that reflect the priorities of that nation. as well as the birthing woman's decision for who her childbirth guide will be and the choices she makes regarding interventions during labor. For example, in the United States, a home birth, rather than a hospital birth, often represents a choice that a mother has made to birth with a midwife in an environment that expects a natural birth. How often does a home birth occur in the United States? 1% of the time. 99% of births in America are performed in a hospital where care is typically governed by a doctor. In an interview from the birth documentary Business of Being Born, Martin Wagner, MD, former director of women's and children's health at the World Health Organization, said, "You can go to all the highly developed countries where they are losing fewer women and fewer babies around the time of birth. And what do you see? You see midwives attending 70 or 80% of all the births, and the doctors are there to take care of the small percent that develop complications. That is the proven system." Why isn't this the system employed in all modern nations? Medical anthropologist Robbie Davis Floyd, PhD, explains in the same film that basically what the medical profession has done over the last 40 to 50 years is convince the vast majority of women that they don't know how to birth. In the United States, this persuasion has now manifested into legal policies that can make a natural birth with a midwife less likely. As we examine these legal limitations more closely, let's clarify some terms. There are two main categories of midwives that may preside over a birth in Canada, the United States, and Mexico: direct entry midwives or nurse midwives, according to the Midwives Alliance of North America. The main difference between these categories is whether or not the midwife has also received training in nursing. The two types of direct entry midwives are certified midwives and certified professional midwives. Certified midwives graduate from a master's level midwifery program. They actually have similar training to the certified nurse midwives and conform to the same standards as the nurse midwives. The vast majority of direct entry midwives in the United States are certified professional midwives. This is the only midwifery credential that requires knowledge and experience in out-of-hospital settings. They are trained to practice in homes and birth centers. Certified nurse midwives are trained in both nursing and midwifery, but their training is hospital-based, and so although they are allowed to provide care in any birth setting, the vast majority practice in clinics and hospitals. Some, but not all, states in the U.S. license certified professional midwives who can provide home care. However, there are currently still 17 states where no licensing laws exist. In these states, midwife-attended home births are illegal, and midwives may be arrested and prosecuted on charges of practicing medicine or nursing without a license. Certified nurse midwives may legally assist home births in any state, but in practice they rarely do, since most of them work in hospitals. As an example of the political pressures that make it difficult for CPMs to practice, policy in the state of Florida recently turned the governance of Medicaid, America's national health insurance program for low-income earners, over to private insurance. One effect of this, says Florida CPM Dana Linville Gordon, is that she now receives only about 1/3 reimbursement for her total prenatal care package. And in order to be reimbursed, she says, now I have to hire a biller and fight, get less, and sometimes wait 6 months to be paid. The other consequence is that low-income earners are, in effect, eliminated from being able to participate in this type of care. Dana says, the low reimbursement causes practitioners to not accept Medicaid clients, or limit the amount of Medicaid clients they take per month. Access is vital and necessary. It's the foundation of midwifery, yet we are cut at the knees and cannot sustain ourselves on less than 1/3 of our fee. This is particularly ironic considering the recurring discussion in the United States regarding healthcare costs. When the average hospital birth costs between $10,000 and $30,000, Dana's fee of $6,500 already represents an improvement in this national debate. Even more, midwives like Dana provide service that may be preferred for many women. I do all their prenatal appointments, the labor and delivery, immediate as well as 6-week postpartum checkups. I am on call 24/7, exchange texts, take phone calls, respond to emails, often make additional visits, discuss when their child gets chickenpox and when to start solids, she says. I'm usually in their life for the next few years. In an interview from the birth documentary Business of Being Born, Martin Wagner, MD, former director of women's and children's health at the World Health Organization, said, "You can go to all the highly developed countries where they are losing fewer women and fewer babies around the time of birth. And what do you see? You see midwives attending 70 or 80% of all births, and the doctors are there to take care of the small percent that develop complications. That is the proven system." In that same film, medical anthropologist Robbie Davis Floyd, PhD, said, "Basically, what the medical profession has done over the last 40 to 50 years is convince the vast majority of women that they don't know how to birth." Compare this to a country like Sweden, which consistently ranks among the best in global childbirth statistics. Here, there is only one ultrasound in 9 months, and commonly no need to see the doctor or obstetrician. 99% of Swedish births also take place in the hospital, but it seems to be who's in charge there that makes the difference. In Sweden, midwives are provided at no cost for the mother, and a doctor will only intervene if there are complications during the delivery. What unfolds at birth is also a matter of that country's ideology and expectations. As one doctor in Sweden said in an interview with The Guardian, "We encourage the birthing woman to try other sorts of pain relief, massage, a shower, acupuncture, before opting for an epidural." These two nations host birth in the same location, but with a vast difference in culture. As Jennifer Block suggested in her book, Pushed, The Painful Truth About Childbirth and Modern Maternity Care, either women's bodies are failing or the system is failing women. Which do you think it is? As you begin to think about the kind of birth experience you want to have, knowing these global realities can help guide you in your process. While your location may limit your options, remember that this process is about uncovering information and expanding your knowledge of the birth system in order to build your own experience. The more you know about the possibilities for your own birth, the better you will be able to make a decision about which path is right for you and your family.